Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast series. Podcast episodes are available on VHHA.com and on popular podcast hosting apps, including Apple Podcast, Amazon, Spotify, and many others. We're a member of the Virginia Audio Collective and the World Podcast Network. Podcast episodes also air Sundays at 9 a.m. on 100.5 FM, 92.7 FM, and 8:20 a.m. across Central Virginia and 1650 a.m. in Hampton Roads. Please send questions, comments, feedback, or guest suggestions to pcfpodcast@vhha.com. Again, that's pcfpodcast@vhha.com. And today we're pleased to welcome Dr. Eric Edwards, who is the Chief Executive Officer of Flowcorp, a pioneering public benefit pharmaceutical corporation. Dr. Edwards is a keynote speaker at the upcoming Virginia Hospital and Healthcare Leaders Summit, which is scheduled for November 5th through 7th, 2025 in Hot Springs, Virginia. Our conversation today will cover Dr. Edwards' career as a clinician and entrepreneur. It will preview his remarks at the upcoming summit and much more. And so with that, welcome to the show, Dr. Edwards. Thanks for being with us.
Oh, thanks for having me. Looking forward to the conversation.
As am I. And so let's just dive right into that conversation. Return listeners of this program know that we like to start these conversations by getting to know our guests a bit better. What we know, Dr. Edwards, is that you are a double doctor with a medical degree and a doctorate in pharmaceutical sciences. As we mentioned, you're the CEO of Flowcorp, and you previously co-founded Kaleo Inc., which is another Richmond-based pharmaceutical company. You're an inventor, an entrepreneur, and you still find time to volunteer with a local rescue squad. And I think I read somewhere that you are a twin. Because each of us is more than just our resume highlights, beyond those few details I just shared, what should people know about your unique personal story?
Wow. Well, first of all, thank you so much for that great introduction. I'm a Richmond native, and I grew up in Central Virginia. I often joke and say that I tried unsuccessfully to get out of Richmond, Virginia my entire life, but it's been a great place to live, work, play. I received my education at Virginia Commonwealth University through the Guaranteed Admissions Program, studying biology and chemistry, and then went into medical school and then did a PhD while starting the first company, as you mentioned, Kaleo. I think that your listeners would find it interesting that the background for why we started Kaleo was that I grew up with life-threatening food allergies, and my identical twin brother and I, growing up in an environment where there wasn't a lot of awareness for food allergies, it was very, very tough. We decided to make a change and try and invent something that could help patients like us who are living with severe allergies navigate that. So we invented a leading competitor to the EpiPen called Auvi-Q and a bunch of other drug device combination products at Kaleo. And that's how I got into the pharmaceutical industry. We were doing this while I was finishing my graduate education, trying to head down a pathway of becoming an emergency physician. And we built these products, got them through the FDA. And one of the most rewarding elements of that was seeing the results of that and helping to save lives.
Well, I appreciate you sharing that and the story of inventing Auvi-Q. As they say, necessity is the mother of invention. And so it sounds like your personal experience led you down that pathway. A moment ago, we mentioned Flowcorp, which is described as a pioneering public benefit pharmaceutical corporation. I gather some of the work is focused on domestic production of essential medications at a time when some data indicates more than half of the active pharmaceutical ingredients for prescriptions used in the U.S. come from India and Europe. There is also a pricing dynamic here, with one recent study indicating drug prices in America are nearly 3 times higher than what many people in other nations pay. I know this is something the White House is working on through its most favored nation pricing and tariff strategy. And so with that background, can you tell me more about the mission and work of Flow?
Absolutely. I'm excited to share this story with your audience here. Back in 2019, following my first exit from Kaleo, we started looking into what could we do that would have significance and really tackle a challenging problem. And what I saw as a medical director on a local rescue squad, as you mentioned, still volunteering, I try to pull shifts twice a month as a paramedic and doctor. I saw that we have drug shortages that are pervasive in this country. They usually number in the hundreds every single year, and this was long before COVID, and they impact some of our most critical and essential medicines. We notice medicines that are critical to sustain the life of human beings, children, adults, medicines for public health emergency, critical antibiotics, medicines for sedation and pain. Each and every one of those medicines had been going through times of shortage before COVID, and Flow started to try and resecure our nation's critical essential medicine supply chain. How could we look at these medicines differently? How could we take a fresh approach to the chemistry and restore America's pharmaceutical sovereignty by manufacturing these medicines back on US soil and the ingredients for them once again? So as you mentioned, it's actually over 80% of the critical active pharmaceutical ingredients, or APIs, that the ingredients that give the drug its action, are made outside of the United States for this essential medicine list, primarily in India and China. And the chemicals that you use to make those APIs, that vulnerability is even more pronounced. Over 90% of those key starting materials are chemical precursors. So at Flow, we set out to resecure our nation's critical supply chain through new chemistry, new manufacturing approaches, to restore America's pharmaceutical sovereignty, and to make sure that we have a resilient, high quality supply of medicines for future generations.
And I want to stay on this topic just a moment more, and I appreciate your insight here. I've read that HHS has awarded Flow a contract to create a domestic supply chain for essential drugs and pharmaceutical ingredients in short supply, and that production work is now happening at a manufacturing facility in Petersburg. You talked about the public health perspective on this, as we saw from the fallout from Hurricane Helene last year and the impact on access to IV fluids that are commonly used in medical procedures. Domestic production has both public health implications and, I think you also alluded to this, national security concerns. I wonder if you could just sort of expand or tease out on that concept.
Yeah, absolutely. It doesn't matter if we're dealing with a public health emergency or a pandemic, as we saw with COVID-19, or a natural disaster, such as a tornado that ripped through a Pfizer warehouse last year, causing an enormous amount of damage. 1 billion doses of medicines had to be spoiled, or Hurricane Helene, other natural disasters, as well as what we're facing with trade disputes or, God forbid, war. All of these things can lead to a vulnerable and tenuous supply chain, and the need for us to look at this industrial base, the active pharmaceutical ingredient industrial base, like we've been looking at rare earth minerals or semiconductors, chips, battery capacity. They're national security industrial bases where we really need to ensure that we have a domestic critical supply available in case of any of these disruptions, these disruptors, whether it's a natural disaster, geopolitical conflict, et cetera. So for us at Flow, we are an advanced contract development and manufacturing organization serving the public interest with the government, and then serving pharmaceutical companies by helping to bring their supply chains back to the United States, using new technology and manufacturing approaches that can really help us compete on a global scale. Julian, it's not that every generic drug needs to come back to the United States. There's close to 2,000 generic drugs, as your hospital members know, and working with their chief pharmacy officers. But we're talking about this shorter list, the top 100 critically essential medicines to sustain the American population in case of one of those disruptions we just spoke about. It's about restoring sovereignty for those medicines end to end on US soil, and that's what our focus is with the United States government as a partner.
And you've just defined why that is so important. As someone who's working in this space, what are the biggest challenges and opportunities in bringing more medicine production back to US soil?
So I think the biggest challenge here is you mentioned the work from the Trump administration on the tariff side and the most favored nation pricing side. A lot of that is on the innovator branded pharmaceutical side. These drugs have the exact opposite economic challenge. This is a pharmacoeconomic disaster where we've had a race to the bottom in pricing, where where one of these critical essential medicines, a vial of a critical drug like dexamethasone or a critical drug like epinephrine or adrenaline for cardiac arrest or anaphylaxis, a vial of that medicine costs less than a bottle of water at the airport. So, with the race to the bottom and the economic challenges associated with it, that is why we've lost our pharmaceutical manufacturing sovereignty in the United States. That's why we've pushed all of this abroad, primarily to countries that don't necessarily have Americans' interest first and foremost at heart. And that's why it's so important. So, the challenge is the economics and the fact that we have some adversarial nations like China that have dumped marketplaces, including us, and especially for our antibiotic supply chain. No, there is no penicillin or beta-lactam antibiotic manufacturing in America left. Primarily, all of that is in Asia. So that's a huge challenge, and having to solve for that and compete against China or India is not trivial. The opportunity, though, is now for the first time we are seeing, because of COVID, raising awareness of the supply chain challenges. We're seeing a resurgence and a desire to onshore these medicines supported by this current administration, but it's also bipartisan. Multiple administrations have said we've got to secure this industrial base. And I am hopeful that Flow is playing a small role towards that goal.
Well, you've shared a lot of really eye-opening information that is informative to me, and I hope to our audience about the importance of this topic. So I really appreciate that. As we've talked about what's being done so far, as you look forward, what are some of the big aspirational goals for Flow in the years ahead?
So our purpose is a bold statement in itself, right? It's to create the future of how medicines are made. We can leverage American ingenuity and we can operate in the zone of genius in order to try to look at these medicines differently and have a fresh approach to chemistry and manufacturing technologies. We're excited because we are on the cutting edge, working to build state-of-the-art manufacturing facilities that are now operational, that allow us to make medicines in the United States cost competitively with greener chemistry, less waste, higher yield, higher quality. And I think that paints a bright future for what we can do here in this country to compete on a global scale. So what's ahead is you'll be seeing more and more manufacturing come back to the United States. I'm sure all of your health systems have been attuned to the great wins that this region have experienced in the last 6 months alone. We're talking about major manufacturers of pharmaceuticals choosing the Commonwealth of Virginia to locate their manufacturing industrial bases for the future, whether that's Eli Lilly right here in Goochland outside of Richmond, or AstraZeneca outside of Charlottesville, or Merck just announced yesterday. This is really sending a signal that the Commonwealth of Virginia is going to be a hub for advanced pharmaceutical manufacturing. And we are proud that our little startup of over 100 employees has helped catalyze some of this activity and work towards bringing back manufacturing here. So the future is bright for the Commonwealth, and more importantly, the health systems who need these medicines to support their patients.
Well, keep up the great work with Flow, and we wish you much continued success. At the top of this conversation, we noted that Dr. Edwards is one of the keynote speakers at the 2025 Virginia Hospital and Healthcare Leaders Summit, hosted by VHHA and the VHHA Foundation. That event is scheduled for early November in Hot Springs, Virginia. The summit's theme is Insight, Innovation, Impact. There's a great program lineup, including Dr. Edwards as one of the keynotes, and we'd encourage anyone listening to this episode to visit vhha.com to access a link to event registration. Dr. Edwards, without revealing too much, can you give us a little bit of a sneak preview of your planned remarks at the summit?
Absolutely. I'm planning on speaking about how we're going to create meaningful change to protect America's medicine cabinet. Not only highlighting a little bit more about my personal journey from Kaleo with AviQ, but also just how this turned into something much more significant. And I think your attendees would love to hear the backstory on Flow and how I slept at the White House, basically nonstop supporting the COVID response, and how all of this came to be. It's quite a remarkable journey during that COVID response that then led to us applying for this contract. So we're going to talk about the backstory, talk a little bit about what we saw with both administrations, and about the future. And as you know, many of your health systems manage emergency response for multiple districts as a part of ASPR, the Administration for Strategic Preparedness and Response. And we'll connect the dots with what Flo's role may be in the future, supporting your health systems there.
Well, sounds like a great speech. I'll be there. I'm looking forward to hearing your remarks. And again, would encourage anybody listening to this to visit vhha.com. If you're interested in learning more about the event, there is an image right on our homepage where you can click, and that will take you right to the registration and landing page. So would encourage anybody listening who's interested in signing up to attend the summit. And then, Dr. Edwards, we are just about done with our conversation. We appreciate your time today. Before we conclude, we do have a tradition here on the podcast to close things out by asking each of our guests a pair of surprise questions to keep things interesting. We have a list of 10 mystery questions that you can choose from. So if you would select two numbers between 1 and 10, I will ask you the corresponding questions.
Let's go with 4 and 8.
Okay. Number 4. If you could spend the day with any person from history, living or otherwise, who would it be and why?
I would say Benjamin Franklin, and that's because of his innovation and entrepreneurial mindset.
Well, I used to live in Philadelphia. I spent 6 years there, so Ben Franklin is revered in the city of brotherly love, so that sounds like a great choice to me. And then number 8 is, tell me one memory from your life that whenever you think of it, it makes you smile.
Well, I think one moment that I immediately think of is when we were in the middle of the delivery and going through the birth of our first child. Of course, my wife did all the work, but I got to assist in that delivery as a medical student, and obviously that was very, very special and a special moment. It brings a huge smile to my face every time I think about that.
It's a great story, and one I'm sure that all parents can appreciate. Well, Dr. Edwards, again, I want to thank you for your time, for being with us, for sharing some of your story, and we look forward to hearing more from you at the upcoming Virginia Hospital and Healthcare Leaders Summit in November in Hot Springs, Virginia. And with that, that's going to bring us to the close of another episode of the Virginia Hospital and Healthcare Association's Patients Come First podcast. If you like what you heard, please make sure to leave us a 5-star review on Apple Podcasts and subscribe so that you know when new episodes are released. And we want to once again thank our guest, Dr. Eric Edwards of Flo Corp, for joining us today. So thank you, sir.
Thank you.